Ending bullying and harassment in the NHS is a topic for all of us. It's common. The NHS is filled with it. All surveys within the organisation demonstrate that bullying is rife. We all need to take a role to try and put an end to that. It's a rubbish way to treat our colleagues.
I know several juniors that have given up on medicine because they were not treated as being valuable. And I think we're all valuable. We all learn. We all have to learn. And I think accepting that idea that we're not perfect and we're not the same, we're all so very different.
I think the most important steps to begin with to tackle bullying and harassment in the workplace is by people treating each other with kindness and respect, having more empathy for the people that we work with.
In my role as a Freedom to Speak Up Guardian within an NHS trust, I think to tackle bullying in the NHS, we need to look at the culture in the organisation that we work in, that people work in, and also to think about the compassionate leadership within the culture. And we need to understand the adverse impact of incivility on people, on the staff, in the trust that we work. And I think also staff right across the organisation need to have and be given the confidence to have those vital conversations, to challenge when there is bullying in the workplace.
I didn't realise about the role of Freedom to Speak Up Guardians. I didn't realise you could just go to them and just have a chat about what's on your mind, and they could give you advice about whether or not you are actually being bullied or if it's something else, and give you advice about what to do next. And I think it's nice to have that little buffer before you go to any formal procedures about just, to have a chat with someone and make sure it is the right thing to do moving forward.
Almost 10 years back, I started using the cultural humility model to address hierarchy within the NHS and develop cross-cultural communication skills training to address this issue, because hierarchy seems to be one of the important factors which results in bullying and harassment.
I think that the most effective way to tackle bullying and harassment would be to demonstrate that it impacts negatively on patients and their experience and on patient safety, and to treat it as an organisational responsibility for delivering high quality care.
If there's one message, I think it is that you need both top down and bottoms up. A cliche joined up thinking, but it definitely has to be the case, because otherwise people see initiatives being referred to, they see policy documents flying around the trust, which doesn't actually in any way mirror what's happening on the ground.
So what I think should be taken to end bullying and harassment is by encouraging those that are experiencing this to speak up, and the only way that's going to happen is by showing them that role models have gone through the exact same stuff, and also showing that their role models are people that they can speak to, because you can only speak to someone if you feel comfortable doing so.
Today, when we address this issue, one of the most important things we find is that if bystanders stand up and speak in support as well, so that people are not isolated, it makes a huge difference to the process.
If the leadership of the organisation model the behaviours they expect of others, then training and advice and support and enforcement is 10 times easier. If those who lead the organisation don't model the behaviours they expect of others, then bullying strategies in an organisation are going to be a car crash.